number of issues. One of them was really to go back to the joint program. So I'm very glad that you've been able to do that. And that now we've got a joint program to which I think we all can buy in, and we can now move towards implementing it. One of the issues that was also raised was all of the reporting. So I'm very pleased to see that that's also something that you have been able to identify, and you will be doing an annual report, but also harmonizing with the national indicators and targets, which I think is something that the whole UN system should be doing in the different areas that we're working on. So I think that's also very good. I'm very pleased with how you've been able to work towards implementing this reform agenda of the joint program. And I think now this is probably one of the programs that I'd like to see as a resident coordinator that should be one of our star programs. It's not because the prevalence rate is low that we shouldn't be worried about HIV rates. I think we need to consistently keep it on the table because we might end up falling into that situation again. But then also we've got other needs, and which is why I'm glad to see the joint program which really combines what we call an outcome, 8, what we also do looking at in terms of the pharmaceuticals, as well as the priority areas. So I think that's very good. What I do want to say is that, at the country level, at the UN CT level, we have really engagement that we would have at every single monthly meeting. There will be a presentation of what is happening on the HIV/AIDS agenda. And we have already started initiating that. So I think that's very good. But then that means that we are monitoring what is happening. So that means that there needs to be an engagement and a continued commitment from all of you. I know that you're a very active group because I see some of these stages in the emails and the dialogue that's ongoing. So I think that's very good. But I also want you to know that we are on our side, on the agency level, and especially at my level. We will be supporting you, we will be working with you, and we will also be monitoring to make sure that we do implement. 2015 is only 2 years from now. It was only last year we were saying it's 3 years ago. Well, now it's 2 years. And we're already the 1st of March, so we've only got 10 months this year. And I think in a country like Ghana, we have to also remember we are now in a very good situation because the national context is very favorable for us. If you look at the partners who we've got, if you see the president that we have, who's somebody who has consistently been engaged in the HIV/AIDS. We've also got a number of ministers who are very keen, so I think we've got an opportunity, but now it's up to us to deliver. This year, we made a decision at the last UN country team that the country team is going to support the whole pharmaceutical industry's initiative. And towards that, I was just mentioning earlier to Yoma that we, from the coordination unit, we will put funding from the RC's office that we have mobilized from Norway, so that you can start off this initiative. So this gives you the idea that we're serious. You have my commitment and you have my engagement, as well as trying to bring on board any other issues that you might have. And it's always consensus building as well, and trying to revise some of the areas we're working on. So I look forward to us really implementing. I want to come back to next year's retreat so that we can really say, but we've already done this, and this. So I think I look forward to having your commitment to action as well as the results that we'll be able to report. So thank you very, very much. Sorry, one thing I want to say, the post-2015 agenda, that's very important because, we had the national level dialogue here and we had then the series of outcome discussions. If the issue of HIV/AIDS doesn't come out as strongly, it doesn't mean that it's not an issue. Okay? It also depends on what the different groups we have coordinated to be part of these discussions. This is the post-2015 agenda, so which is why we have to also remember that HIV/AIDS will still be there with us post-2015. And that's why it's important for us to ensure that we are able to include HIV/AIDS in the different discussions. And can't afford to not be a part of it. I mean, HIV and AIDS can't afford to not be a part of it because it is, it is a social phenomenon. It is something that impacts the country economically.